Welcome to Wellbeing Wednesdays, brought to you by the Tulane University Counseling Center. I am one of your co-hosts, Shawna Foose. I'm a staff therapist at the center, and I'm joined as always by my co-host,
Dr. Jinaki Flint. I'm a staff psychologist at the Counseling Center, and we are joined by one of our favorites, Dr. Dani Archie. He's also a staff psychologist here at the Counseling Center. Welcome, Dani. Welcome back. We love to always have you. I think you're one of our most frequent guests.
Yeah. Love to be here. Thanks so much.
Well, we wanted to take today to talk a little bit about what makes a therapist, and to maybe dispel some myths that our community might have around what happens in therapy or how to access therapy. So maybe a good place to start is for us to talk a little bit about this term therapist and who people are that practice therapy. We have, multiple credentials that different clinicians in our center hold. So you both are psychologists, right?
Mm-hmm. Yep.
And I'm a licensed professional counselor. So let's talk about those differences a little bit. Why don't you guys talk a little bit about your training?
Yeah, I think I'm a counseling psychologist, which is, I think there's different fields of psychology as well. Again, we all get the same kind of credentials and licensure, but our training is just a little bit different. And so I think in practice, a lot of what we do is similar, but it's just kind of our training and framework that we come from that may be a little bit different. And so a psychologist has a doctorate degree and is kind of has a basis in kind of psychology and takes a lot of classes about like psychology in general. But then we also kind of get those, if we are in clinical or counseling psychology, get those classes specific towards kind of doing therapy. And so it's kind of a broader base, I think, to start with that psychologists kind of come from in kind of just those psychological concepts.
Yeah. What about you, Jinaki?
So it is interesting that we have all of these different kind of ways in which we can practice the discipline. So I am what's called a PsyD, a doctor of psychology. And this was something that was kind of solidified in 1973 at the Vail Conference, that just kind of pretty much stated that psychology had reached a space where we could do these different kind of disciplines within that. So what this is called is a practitioner scholar model, which is essentially just an advanced educational and operational model that's focused on the practical application of this scholarly knowledge. So it's more of a preparing students to be out in the workforce and practicing. So preparing them for clinical practice as opposed to on a PhD side would be preparing them for more empirical research. So it's based on research, what PsyDs do, but it's also using that research for practical application and scholarship and to be able to walk out and use the knowledge in the field.
Yeah. How many years did each of your degrees take?
6.
Same here, 6.
And did that include your practical training, practicum and internship training?
Yeah.
Yeah, so our second year, we have what's called diagnostic practicum. So it's all around diagnostics. I did mine in neuropsychology. So I did that year at a hospital, a clinic actually in the area. And then we have 2 therapy practica, which is you do like a first one and then you do like an advanced practicum. And then you start preparing for internship and so on. So that was pretty much how my practicum experiences happened.
Was yours similar, Dani?
Yeah, pretty similar. I think that starting second year, we had practicum along with our classes. So about like 20 hours a week, we were doing work.
That was the standard.
Yeah, and we had, let's see, 3 years of that, of doing that, and then 1 year full-time internship. And then 1 year postgraduate where we're still under supervision.
Yes.
So we're getting support from an advanced professional, but we're technically graduated and, you know, our own professionals.
Yeah, yeah. And yeah, we have to do postdoc work. Not just that, you know, our school, most schools, I can't say most schools, but I know my school required it. And also the licensure boards, depending on the state, also require you to do postdoc work.
Yeah.
And so you do those, we had diagnostic, 2 years of therapy practicum, then you go on internship for a year. And then after the internship year, you do a postdoc for a year. And then they let you out.
Then you're eligible to be licensed as a psychologist.
Yes. Well, you have to pass that dissertation.
Right, dissertation, you have to pass a test, right? A national test.
And pass the EPPP, yes.
Yeah. So lots and lots of layers of training, academic work, and then just supervised practice in the profession. Yeah. So similarly, you know, I have a master's degree in counseling psychology, and in most states, you can get a licensure at the master's level, either with a degree in psychology or social work. And they're two different structures and philosophically really different, I think. And depending on where you go to your social work program, you can learn a lot of the clinical side of psychology. And so it really depends on, I think, the programs, but the states dictate how those credentials are licensed. And so, yeah, my master's program was right around 2.5, 3 years. I was in an accelerated program. Most are about 3. I finished up a little bit more quickly because we just didn't stop. You know, there was no breaks. We just kept going. We had a 1 year practicum. So it was in a clinical setting, 20 hours a week for that 1 year. And then when you complete that degree, the master's degree, you take your national licensing exam, which is different than the psychologist exam. It's called the national counselor exam. And you become eligible for a provisional license to begin to practice, but you have to be supervised. And you have to do that for about 3 years. It's actually hours. You have to log a certain number of supervised hours before you become eligible for your full license that allows you to practice independently. And that varies somewhat, those requirements from state to state, but I've found in the states I've lived in, it's been about the same. And then, you know, we're all responsible for continuing our education, right? In order to keep our licenses, we have to go to continuing education places and take seminars and do workshops, right? And continue to learn and grow and advance. I think that's another really key piece of our kind of training and experience. What do we want to tell students about what happens when you come for therapy? I think for someone who's never been, it can feel really daunting, or maybe they've only seen it on like television or in the movies. What can we tell them about what happens in these spaces?
I think one thing that I try to tell clients at the front end and help them keep in mind is that first session may feel a lot different than the rest of them. And so, you know, that first session where is kind of a information gathering session. And so we may ask about a lot of things that seem irrelevant, but it gives us kind of a broad picture of who you are in your life, so that as we start to kind of get into the issues that you're wanting to work on, we can have some clues of like, oh, I wonder if it's related to this or this. And so kind of having that good understanding of your life kind of gives us some frame to work in. Yeah. And so a lot of times I think people go to that first session and they're like, well, this is weird. I just got interrogated the whole time. But that's not necessarily what it's going to look like the whole time, you know? And so it's just that first kind of, we ask about a lot about history. And then from there, we'll kind of start to spend some more time kind of breaking things apart.
Yeah, I often say to clients, like, it's helpful for me to understand you in the context of your life.
Yeah.
To
help kind of guide that conversation.
Yeah, history taking is I think it's pretty critical. and knowing when to stop on the train and allow the story to come to you. And then when to, take that general history. And especially if you're looking at people's intersections, I think it's important to be asking certain questions. But I think one of the things that oftentimes I think students may find is sometimes what they may have thought therapy was may look different.
Yeah.
So oftentimes, sometimes students may think that therapy is about problem solving. Like, I have a problem, fix it, right? And they're surprised that, in a good way, that it may not have been that, but it's so much more, right? And it can be so much more helpful to you in helping you gain autonomy so you can make those decisions and problem solve for yourself. And so one of the big myths, I think, is that we are major problem solvers, that you will come in here and we will just make everything better and fix it.
Yeah.
And which is it's not a, it's not a judgment, because I can see how if you are really, really stressed, you're going to want to go to somebody to fix it.
Yeah.
Because we live in a world we're socialized to, if there's a problem, fix it, right? And so that's one of the myths I think that many students come with. And then they come with their own stigmas, like they don't know what this is about, but they've heard that it might not be that great. Or they heard that we're going to do a lot of talking, and that they're going to have to be speaking a lot, and they don't really like talking or doing small talk. I don't like small talk either. And then when they realize that, oh, it's not just that.
Yeah.
So I think for most students coming in, they really are pleasantly surprised that it's not what they thought, and that it is so much more in terms of helping them to build strengths and build on the strengths they already came with.
Yeah.
Yeah, I think.
Go ahead, Dani.
Oh, I was just gonna say, I think to build on what you're saying, that students kind of have this idea that we're just going to fix things and wave this magic wand and their problems will go away. I think that kind of goes along with this idea that sometimes people see us as experts, and we are experts to some extent. We're experts in understanding psychological theory and how that impacts our thoughts and behaviors and emotions. But really, clients and whoever's coming to our office are their own experts as well, and they're experts about their own life. And so some theories about counseling kind of show that, like, we believe that people have kind of some abilities to solve their own problems, and really what we can offer is giving some insight so that you can kind of understand what solutions are going to work for you and what paths to take. And so oftentimes we see ourselves as like a mirror, right? And so you come in and we're kind of reflecting things back to you in a way that can kind of give you some context to understand what's going on with you, so that you can kind of then make some decisions that kind of help align your behaviors to your values and what's most important to you, and get you kind of maybe unstuck from some habits or patterns that aren't healthy for you. And so it's kind of this process that we go through of helping you kind of gain some understanding into yourself, as opposed to us just kind of telling you, here's your problem, here's a solution, maybe like a medical doctor would, right? Give you a diagnosis, give you a pill. Therapy is a lot more involved than that.
Yeah, and kind of tacking onto that, I think sometimes folks will say, what's the difference between talking to a therapist and just talking to my friends, right? And I think what's different in a therapeutic relationship is your therapist doesn't have a judgment about what you should or shouldn't do or have not done. Friends will have opinions. Friends will tell you what to do all day. In the therapeutic relationship, one place we try to sit is in a really neutral, observant place, and help you do that too, because usually we're our own worst critics, right? So we're judging ourselves internally all the time. And it's a really unusual relationship. I don't think that it's an easy thing to find in this world, a place of true, non-judgment and trust.
I think another difference, which I think is one of the great things about therapy, is it's a pretty one-directional relationship, right? That you don't have to give back, right? You can come in and feel as selfish as you want and spend an entire hour talking about whatever you want to talk about, and you don't have to ask us about how we're doing, or care about us at all. And so I think it's really freeing, because in a lot of other relationships, there's that give and take, right? There's that, giving support and getting support. Where with us, that, we're here just to give. And so you can really just let it all out and not have to worry about it.
Yeah, you can truly come in to take care of yourself and let us help you do that. Yeah. What are some other
That's
myths?
the difference between, I think, the friend and the therapist, I think, too, is that once you establish the relationship, some people come in and they don't really trust the process because it's a different person, it's a stranger you're telling these most intimate details of your life with. But the thing about your therapist is that we are not here to sit in judgment of that, as Dani said, as Dr. Archie said, but we are basically listening to what you're telling us is a way of getting to know how that has been operating in your life, how that has been impacting your functioning, right? How it has, is there a tide to it? Is there an ebb and flow to what you're doing? And so it is a space where you can come and you can sit and you can kind of let it all out. We're bound by rules and ethics like confidentiality, right? And you get that speech at the beginning of like when that can be breached and when it holds strong, right? And so it's a real private place too for you to just come and talk to us and sit and really share those things that you may not have shared before, may not have felt comfortable sharing. And I find that the relationship part of therapy is, and the research backs me up on this, is really the number one thing that really drives the healing process.
Yeah, it's not like any other relationship.
Mm-hmm.
What other barriers can you all think of that might stop a person from coming through our doors?
I think that a lot of times there can be this stigma that if you are seeking help, that you're weak in some way, right? And that you're showing a weakness. And I think this is especially true for certain groups over others, especially like men, for example, may feel as getting help is showing a weakness. But I think it really takes an incredible amount of strength to stop running from your problems, turn around and face them, and admit, like, I need some help with it. And I think it's really the opposite of weakness to come to therapy. It's saying, this is too much for me and I need some help. And it doesn't necessarily mean that you can't handle it. It just means you need a little support in that process. And maybe you don't even need the support. It just helps, right? It makes it easier, right? Maybe you can handle it, but if you can make it easier, why not, right? You don't have to white knuckle life. And so, I think that's one thing that keeps people away, is just not wanting to appear weak or admit that there's maybe a problem.
You don't have to white knuckle life. I love that.
And on a bumper sticker. Yeah. I think too, sometimes I think some people feel like maybe their problems aren't bad enough, or they haven't hit rock bottom.
Mm-hmm.
So that like therapy's not for them. Mm-hmm. How would y'all respond to that?
And maybe it's not, right? So there could be some truth to that. And sometimes it is also people just not knowing enough about how therapy works, mm-hmm. right? Or it could be a one and done. Like sometimes you just need to kind of sit with somebody to work this issue out, mm-hmm. right? And so maybe you don't have a way of kind of working it through. And so once you've worked it through, you're like, okay, I'm great. I really didn't need anything besides that. I got it. I feel like it's working. And so you don't need to come back. And then sometimes things are more chronic. So I'm always checking for functioning. I'm always checking for intensity, duration, frequency of the problem, and how it's impacting you academically. By functioning, I mean academically, occupationally, socially. So if this thing is permeating your life in such a way with increasing regularity, increasing severity, then you may want to come through just to kind of talk about it, right? To just get some perspective, if nothing else.
And you may not know what the thing is. You may not
Right.
know why it's impacting your sleep, why you're not sleeping well, why you can't concentrate. You might not really, and that's okay. We won't magically know either.
Right.
But we can help create a space to maybe start figuring it out. I think sometimes students worry about that. They worry like, I don't even know what my problem is, you know? And
Right.
that prevents them from coming in the door.
And it's my belief that we act as partners, right? We act as therapeutic partners on this journey. Like sometimes we may drop something to provide some insight. We have the training to be able to kind of show, like, help you explore those patterns. But we're really acting as a partner with you. So you don't have to, as Dr. Archie said, white knuckle life, which I love that.
Yeah. And I think another response I would have to what Shawna said was that, again, maybe not everyone does need therapy, but I also think that there's not necessarily, if there's that dysfunction, that if that's going on, that maybe come in, but also if you're in distress, like if you're having a lot of distress in your life, that's a reason to come in. And I think that there's no distress that's more important than another, right? And so if you're having some anxiety or worries or finding it hard to relax or feeling really down or just really annoyed by everything, and that's not your usual self, it's some distress is going on, and that's important, and you are important enough to address that, right? And so just because someone's had a worse life or doesn't mean that your issues or what you're dealing with isn't important, that everyone's got their own stuff, and it's important to take care of our stuff, whatever that is.
Yeah, because that stuff bleeds out into the world. And so the sooner you decide to address it, the better it is for you. Especially if you are to the point where you're actually questioning whether or not there's a thing, it probably means that you're ready to actually ask someone with the training and to partner with someone to explore that. Because usually sometimes people don't even, they don't even know yet, right, in their minds of what that might look like. But I want to go back to something around the barriers to it, because it's not just stigma. Sometimes there's a cultural barrier. Sometimes there's this idea that this person won't understand me or my issues or what they are, or they will invalidate my experience. And that's scary. No one wants to walk into a wounding situation. And so I think that that's one of the things that I know I try to do with the community engagement piece. And I think that all of us have been really active in trying to dispel the myths around those cultural barriers that people will have experiences in therapy that, we try to actually ask people for preferences and things like that to to try to ensure that people will at least be able to sit with someone that they may feel. We're not always able to do that, but we have therapists that are trained in ways in which to discuss those cultural issues and to talk about your intersectionalities, like who are you as a woman, as a daughter, as if you're LGBTQIA plus, we have, you speak a different language, right? So there are all these different pieces and parts that make up you. And so being able to sit in front of someone who has an idea of that, or who is empathic towards that, or who understands that is critical.
And I think that to speak to that, one way that I really view people that feeds a lot of how I do therapy is remembering that each of us is like every other person. We're like some other people, and we're like no other people, right? That we all have unique things about us that don't fit anyone else. But we also have some common humanity. We all experience the same emotions, and our emotional experiences can be very similar. But then there also are cultural factors that some people have specific experiences that relate to that other people don't understand. And so when I look at a person sitting across from me, I'm keeping in mind all of that, right? I'm trying to see this whole person and realize there's parts of their experience that I can't know, right? I can listen and I can, do my best to be empathetic, but I can't know on that I've experienced that, right? But that doesn't necessarily mean I can't help. But maybe also it might be important for you to know that the person across from you can know, right? And that's okay too. And so,
right.
I think it's okay
to be
to ask
honest about that.
Yeah. I think it's okay to ask if that's an important thing to you, but at the same time, I don't think it's an automatic exclusion, right? That, you know, I can't work with someone who's different than me. And I think that we do have a lot of training in working to understand the differences that we all kind of hold.
Mhm.
Yeah, I mean, we have training in how to be more culturally competent. You know I'm always, there's always more for me to learn and understand. And I try to let students that I work with know that I'm just really trying. I'm going to do everything I can to understand their perspective, and I also know the limits to my ability to do that, right? So, and yeah, when I talk with students about their preferences around the type of therapist they work with, I very explicitly say, you get to say your preferences. You get to tell me gender, race, ethnicity, language, all of these things. It's not personal. And we want you to be paired with a therapist who's a good fit, because that's such a key piece to success in therapy.
I think to speak on that it's not personal, as well as I think another barrier, not so much to seeking therapy, but to continuing therapy, is sometimes
I'm sorry, what?
It's a barrier that people have to continuing therapy is sometimes they feel as if they can't speak up when things are not working, right? And that they're afraid to be maybe direct and honest with their therapist for hurting our feelings. And the truth is, we want to know, right? We're here to help.
Oh, yes.
If we're not helping, then tell us, right? And be honest. And we might try a different approach. We might kind of brainstorm what's going on. And sometimes it might be we need to find a different person, right? We recognize that we can't be everything for every person. And so I think it's important not to give up if things aren't successful right at first, right? Sometimes therapy, things get harder before they get easier, but also sometimes if it's not working, there's other ways that we can approach it, right? There's not one path to get to the place you want to be. And so being direct and honest and saying it's not working really is only in your benefit. And we're here to problem solve that and help figure that out.
Yes, that is a huge point, because that is something that I think that's another stigma around therapy and the therapist. And I think what you speak to also is power dynamics in the room.
Yeah.
And one of the things I know, and I speak only for me, is that I instantly try to reduce as much of that as possible. And not, it's not I'm the doctor and you're the patient, down here. Like, we're right here. And I really am big on partnerships. And so if there is something that you can't say, or you feel that you can't say, then that to me is kind of like, okay, start seeding that. They're your partner, you should be able to talk to, right? And so talk to them and say, I can tell you, I have students that will say, well, I don't know about that. Or if I'm thinking that I'm tracking well, and they're like, well, no, that's not where it went, And so we just have to, and I think as therapists, we have to be honest when we also, make errors and say, oh, my bad, I didn't hear that part, or I didn't understand that part. And that also helps the student to be more honest with you as well, if they see that you are receiving information, in a way that is helpful.
Yeah. And I think, honestly, I've had some of, I think, the most healing experiences for clients when they were able to say to me, you're getting it wrong. And you hurt my feelings, or you offended me. And I can be like, whoa, you're right. Because we're humans when it comes down to it. And we're very trained, and we get a lot of support to do this work. But it doesn't mean we're infallible. And so being able to work through a conflict, you then learn that skill to then take in your other relationships. Because again, therapy is a relationship. And so that it's got to be that willingness to kind of talk through a problem. A lot of times it can help you then work through those same problems with other people. Because I think the problems you have in your relationships outside of therapy play out in the room as well.
Oh,
and so,
totally.
We're ready to work through that. We're ready to address that head on and again, see ourselves as partners working against this problem, not as kind of working against each other.
Awesome.
Yeah.
I use that a lot in couples therapy. It's two of you against the problem.
Yes.
Well, that's a good segue, I think, Jinaki, into different types of therapy, right? There's individual one-on-one therapy. There's couples therapy if you're in a partnership with someone and you need to have some help working that out. There's family therapy, and there's group therapy. And you know, different therapists can do different things and have different expertise in those areas. We offer at the counseling center, we do couples work, we do group work, and we do individual. I don't think we've done family therapy at the counseling center, but that doesn't mean we couldn't if we had somebody with the right expertise, right? And I know the three of us, we all are group therapists, you know. Let's talk a little bit about group therapy and what people might be thinking about that.
I think a lot of times people have some hesitation with group because I think there's maybe that extra layer of having to be vulnerable, not just to this one stranger, but these other strangers. I think another barrier sometimes people have around group is feeling like, well, I'm here to deal with my problem. I don't want to have to share my time with somebody else. And it kind of feels like it's maybe splitting, right? You're splitting the treatment between different people. But I think it's important to realize that there's aspects about group therapy that are healing and effective that are different than individual therapy. And it's not necessarily like splitting, you know, your time with other people. That process of interacting with other people who are dealing with similar things can be really, one, help you feel less alone and isolated, because mental illness can be really isolating. So knowing other people are depressed and are in the same place can really help you. But also, again, it helps you play out those same issues you have in your life with the people in this safe place, right? And that you can kind of have that place to explore those things and gain some insight, not just into your own kind of like internal workings, but how you work with others and how you interact with others. And so a therapist can see a lot more of that when you're interacting with others, right? And we can give you some of that feedback, and as well as the other group members can give you some feedback that maybe wouldn't be possible in a one-on-one session.
Yeah.
That's a good point.
And I think, you know, part of our training around doing group therapy is how to keep that environment safe and boundaried, so that feedback is delivered in a respectful, trusting way, right? So it's not just anybody can say anything they want. The therapist is there to really hold the space and create that safe container. And there's so much benefit to all those interactions and the way that plays out. And groups can look different, right? Like some groups are skills-based, and some groups are more about processing and talking out what's happening with you in the room with other people who've had a shared experience, a similar experience.
And some groups and many groups, as we have, are support-based.
Right.
Basically, you just show up and get supported. One of the things, too, that I think students also have myths about is that in every group, you will be asked to talk a lot and share your stuff with other people. There are some groups that you really don't really have to do that, or in groups where you don't have to always do it, right? So like, for instance, I run a skills-based group. If students want to speak up and say something, they can. If they don't have to. And then some days, no one's speaking because we're doing work. So we're in the way that the group is formulated, is designed so that people don't really feel that they don't really get asked to speak on their own issues, right? Because they're specifically there, and they've agreed to be there to learn this specific format or ways to manage certain, you know, things that they're dealing with. And so I think that's one of the things that students may have certain myths about, is that if I come to a group, I'm going to be put on the spot. I'm going to have to be speaking, and people are going to be looking at me, and I don't really want to be around these strangers and things like that. And especially on Zoom, you would think it would be less daunting, but it's more on a Zoom call. And so this kind of virtual space kind of sometimes heightens that idea for students as well. So we want to just put that to bed and let students know that not every group really has that. And many of them don't, you know, so, you know, we have a host of support groups this season, like more than ever since I have been here. And so it is so important to really look us up online and check out our group offerings. because that is really a very robust part of the counseling center. And it can really, one, work as a great adjunct to therapy, and two, act as a space to kind of get yourself acclimated to the therapeutic experience.
Yeah.
And then there's some other spaces in between that it could actually work for as well. You gain some practical skills and knowledge. You get support around some issues you you might not have even known you could have support around. So I just encourage students to check those out because they're really, really great offerings.
Yeah.
Yeah, and I think those skill-based groups are great for maybe someone who isn't wanting to talk through a lot of their problems, and maybe individual therapy isn't the right space for them, and they're just wanting some ways to manage stress, right, or manage the symptoms that they're having, and just kind of learn those skills without maybe having to dig deeper, and you're maybe not ready for that or not wanting that, and that's okay. And so I think those skill groups can be really great for just that right there, and you don't have to be in individual therapy necessarily, but they can go along hand in hand.
Because not everybody wants to make that commitment either, right? Because it's like, every other week, you have to carve out some time in your day. You may not want to do it that way. That's an excellent point that, these are great ways for you to gain that knowledge without really having to have that engagement. You could just go someplace and especially with skills-based, even if you just show up to that group, you've done one thing for yourself that week, right? And so those are really, really great. So I'm glad you brought that up.
Yeah. So as we kind of round things out to finish up this episode, what would you say to a student? What would be your kind of elevator pitch to a student who's like, I'm thinking about going to therapy?
I might say, what's the harm in trying? I think that, again, it's a way to value yourself and say, I'm valuable enough to take this time. And maybe you need it for a short period of time. And maybe it's a longer term thing. Maybe it's you do it a couple sessions now and then you feel better, but in a couple years you come back. Therapy can look a lot of ways, right? There's not necessarily this one, way that it works. And so, coming in, trying it out and seeing what's what, and at least maybe getting kind of some feedback about what might be helpful for you specifically. Again, we can do that all in one session of here's what is going on, here's what might be helpful. And then you can kind of decide, yeah, I think I can commit to that, or maybe now's not the right time for me. And so I think there's no harm in kind of making that first connection. And sometimes even it's helpful to make that connection when you're not in a crisis, because then when you're in a crisis, it's easier to come in, right? If you've been to therapy once, you've met a therapist, you've sat across from us, then when things get real bad, it feels a little bit easier to come see us. So.
Yeah, that's always a part of my pitch is if you're feeling okay but not great, it might be a good time. It's kind of like taking vitamins. You don't wait until you're real sick to start taking vitamins. You're trying to maintain some health and maybe shore up your health a little bit by taking, a vitamin. Maybe therapy works in that way for some. Of course, if you're in crisis or distress, come see us. But if you're just contemplating and wondering, it might be a great time. It might be an opportunity.
And it's an awesome way of taking care of yourself. This is self-care. Self-care, it's always like educating around, like, it's not just going to get a mani-pedi, right? Like, okay, I'm going to take time and go get a massage, right? Sometimes it's going to the doctor, right? And sometimes it's seeing a therapist. And so one of the things that I'm very fond of, I'd love to really validate my students' experience really giving them a lot of good feedback around how wonderful this choice is for their own self-care, being able to take that on as, and say, what, I think I might need to do this, and going in and trying it out, even if you don't know anything about it. One of the things that I see a lot of is peers telling other peers, like, you might want to go try this, right? And so now I think that this is really starting to, take traction. It's starting to gain some traction. And I think that it's a wonderful way to take care of yourself. It's the greatest self-care.
Yeah.
Especially if you're feeling very kind of disconnected, or if you're feeling like something is not quite right and it's showing up in your life in some regular ways, in some more severe ways, impacting you, and you decide to bring yourself to the counseling center or to another therapist. Either way, it's really great self-care, and you should be proud of it.
Yeah. Well, I'm going to share my screen just to give everybody the info for how to come to the counseling center. So I think we have such a great model for how students can kind of jump on that opportunity when they feel like they're ready to come to us. You make a phone call, and in most cases, we'll have you see somebody that very same day. Your first appointment is a consultation, so it'll be with one of us, one of the clinicians on staff. And, kind of like Dani said, it's a kind of an informational session, hearing a little bit about what's happening with you, trying to kind of get, just the initial understanding of what's going on. And then us letting you know what services we think might make sense and making some recommendations. And then you're in the driver's seat. You get to make those decisions around, what partnership you would like to have and how you'd like to proceed. So if you call the counseling center at 504-314-2277, you'll get to speak to one of our patient representatives, Belinda or Charlesetta, and they'll get you set up as quickly as they can to get to talk to somebody. At this point, we do almost everything on Zoom so that we can keep everybody safe and not have to wear masks, because we really want to get to observe each other and try to have as much kind of clear communication as we can. So we do everything through Zoom. Don't forget to follow Campus Health on social media. You'll get to see these episodes on IGTV or on YouTube, and you'll get reminders about this and lots of other offerings coming from the Counseling Center and the Health Center. So follow us. We're getting into the home stretch of at least our on-the-ground portion of the semester. I know a lot of students are going to be heading home close to the Thanksgiving holiday. It's, we had a hurricane, we've had an election, and we're all living through a pandemic. And I think sometimes it just feels like we can't keep going, but we can, and we're here to help support our students as they're doing that. So that's just my little hang in there meme for today. Well, I think this kind of conversation really can help to demystify the work that we do in the counseling center. It's funny because our door's always closed. We're always in a private appointment. And so I think sometimes folks who don't come in wonder what's going on in there, right? So I hope today, I think that with this conversation, that we've let them in on some of the secrets of what's happening in therapy. So thank you both. And we will be back next Wednesday, so don't forget to tune in. We'll see you all then, and in the meantime, please be well.